As part of the governor's phase 1 of reopening, medical and clinical practices can now start taking patients for elective procedures.
That includes places like doctors' offices that have had to cancel appointments for weeks. News 8's Sierra Hignite joins us now live with how they're going about business. Sierra.
Yeah, that's right, you guys. I'm here at a family medicine practice here on the south side of Indianapolis. And here, not only are they seeing regular patients, but they're also seeing respiratory patients. And people who came here for appointments today saw things that were much different than if they would have had an appointment before the coronavirus pandemic. Now, places like doctors' offices, they're taking many new steps to protect both patients and staff. The first order of business for doctors' offices and hospitals who can now conduct elective procedures are to take care of the more serious cases that are backlogged from the previous restrictions. Dr. Christopher Doring with Franciscan Health says they're being very particular about the patients who can start to be seen.
Particularly if someone had any symptoms whatsoever that would suggest COVID, those types of cases are being screened out and delayed until someone's completely symptom-free.
Offices are limiting the amount of people who can be inside at one time, and they're trying to avoid patients sitting in the waiting room.
You'll see things kind of slowly ramp back up. We will not be jumping, full bore back into business as usual.
Today, News 8 was at a doctor's office that moved their respiratory treatment area to a makeshift office outside, away from other patients.
Maybe certain parts of the day, we're seeing healthy, well patients or more routine things, and then setting up another part of the day for patients maybe who are experiencing some respiratory issues.
Doctors and nurses are amping up the amount of PPE that they're wearing during visits, as well as having patients wear masks.
We don't want to push too far too fast and use up too much of our PPE. We don't want to run into a situation where we're filling up the hospital again.
While offices are making a lot of physical changes to the way they do business, doctors are also having to change how they treat their patients.
The simple act of shaking a hand and putting a hand on a patient's shoulder to sort of put them at ease, those types of things are either not going to happen or they'll be with masks on.
Now, Dr. Doring told me today that ideally hospitals and doctors' offices, they'd like to test every patient that came in their doors for the coronavirus. But unfortunately, the current testing capacity doesn't allow that. However, he says it's not out of reach for that to happen in the near future. Reporting live on the south side, I'm Sierra Hignite, Wish TV, wishtv.com, and follow us on Facebook.